If you are over 60, there is a moment in the morning that many people quietly fear. It usually happens just after waking up. You sit up, or you stand up, and suddenly, something feels wrong. The room feels unsteady. Your head feels light. Your vision may blur for a moment. Some people describe it as dizziness. Others say it feels like weakness. Some feel their heart beating faster than usual. And for a few seconds, there is a quiet thought. Am I about to faint? Is something wrong with my heart? Is my blood pressure too low? This experience can be frightening, and yet, many seniors never talk about it. They assume it is just age, or they assume it is harmless, or they assume it must be dangerous, but they don't know what to do. This is exactly why we are talking about it today. Because sudden drops in blood pressure in the morning after 60 are far more common than most people realize, and they are also widely misunderstood. Some people panic when it happens. Others ignore it completely. Both reactions can be problematic. The truth lies in between. Morning blood pressure drops are not always dangerous, but they are also not something to dismiss without understanding. To manage them safely, you need clarity, not fear, not guessing, not reacting to one moment. Clarity. Let's start with an important fact. Blood pressure does not behave the same way after 60 as it did earlier in life. The systems that regulate blood pressure become more sensitive with age. The heart still works hard, the blood vessels still respond, but the coordination between systems is not as fast or as smooth as it once was. This means that changes in position, especially moving from lying down to standing, can have a much stronger effect on blood pressure. At night, when you are lying down, blood is distributed evenly through the body. Your heart does not need to work against gravity. Your nervous system is in a resting state. Your blood pressure is often lower and more stable. But when morning comes, everything changes. The body prepares to wake up. Hormones begin to rise. The nervous system shifts toward alertness. And then, you move. You sit up. You stand up. Gravity suddenly pulls blood toward your legs. In younger bodies, this adjustment happens almost instantly. Blood vessels tighten. Heart rate adjusts. Blood flow to the brain is maintained. But after 60, this response can be slower. For a brief moment, less blood reaches the brain. That moment is when dizziness happens. That moment is when weakness is felt. That moment is when many seniors become afraid. What makes this even more confusing is that many people associate blood pressure problems only with high numbers. We hear so much about high blood pressure that low blood pressure feels unfamiliar. Some seniors ask themselves, is low blood pressure bad? Can low blood pressure cause a stroke? Is this an emergency? These are reasonable questions, but the answers are not simple yes or no. Low blood pressure can be harmless. It can be uncomfortable, and in certain situations, it can be dangerous. The key is context. This video exists to give you that context, because reacting without understanding often leads to the wrong decisions. Some people rush to check blood pressure repeatedly. Some people skip medication out of fear. Some people avoid standing or moving at all. Others do nothing, even when warning signs are present. Neither extreme is helpful. Another important point to understand is that morning blood pressure drops do not happen in isolation. They are connected to sleep quality, hydration, medication timing, nervous system sensitivity, how you move in the morning. This means that what happens at night affects what happens in the morning, and how you respond in the first minutes after waking can make symptoms better or worse. If you've been following this channel, you may recognize a familiar theme. After 60, health is less about force and more about timing and support. The body still knows how to regulate itself. It just needs the right conditions. This is especially true for blood pressure. Many seniors are surprised to learn that sudden morning dizziness is often not a heart problem at all. It is a circulation and nervous system issue. That does not make it unimportant, but it changes how it should be managed. Fear tightens blood vessels. Tight blood vessels worsen symptoms. Calm responses support recovery. Understanding reduces anxiety. Reduced anxiety protects the heart. That is the approach we take on this channel. We do not rush to conclusions. We do not use fear to get attention. And we do not oversimplify complex issues. Instead, we explain what is happening, why it happens, and how to respond safely. In this video, we will walk through this topic step by step. First, we will talk about what sudden blood pressure drops actually feel like after 60 and how to recognize them. Then, we will explain why blood pressure drops when you get out of bed, using clear language without medical jargon. We will also discuss medications that can make morning blood pressure drops worse, not to encourage stopping treatment, but to help you understand patterns. Next, we will talk about what not to do when blood pressure drops, because some common reactions actually increase risk. Then, we will show you the safest way to stand up in the morning after 60, a simple routine that many seniors find helpful. Finally, we will explain when low blood pressure is dangerous and when it is simply part of the body's adjustment. By the end of this video, you will not need to guess. You will know when to stay calm. You will know when to slow down. And you will know when to seek medical advice. This knowledge does not eliminate risk entirely, but it replaces fear with understanding, and that alone can make mornings feel safer. So if you've ever felt dizzy after standing up, if you've ever worried about fainting in the morning, or if you've ever wondered whether low blood pressure is something to fear, this video is for you. Let's begin by talking about what sudden blood pressure drops actually feel like after 60, and why these sensations can be so unsettling. When blood pressure drops suddenly in the morning after 60, the experience is often confusing. It does not always feel dramatic, it does not always feel painful, and it does not always feel the same from one person to another. This is one of the reasons many seniors struggle to describe it. Some say, "I just felt off." Others say, "I felt weak for a moment." Some say, "The room didn't feel steady." Because the symptoms can be subtle, they are easy to misunderstand. Let's talk clearly about what these sudden blood pressure drops usually feel like after 60. The most common sensation is lightheadedness. This is not spinning, and it is not the same as vertigo. It feels more like the head is lighter than usual, as if the brain is not fully anchored. Some people describe it as a floating feeling. Others say it feels like they might faint, even though they usually do not. This sensation often lasts only a few seconds, but during those seconds, it can feel alarming. Another common sensation is momentary weakness. This can affect the whole body, or just the legs. You may feel that your legs are not fully reliable right after standing. It is not true muscle weakness. It is a temporary reduction in blood flow to the muscles and the brain. Once circulation catches up, strength returns. Many seniors notice blurred or dim vision. This might look like grayness at the edges of vision, a brief narrowing of the visual field, a moment where things look less sharp. Again, this is usually brief. It happens because the eyes and brain are sensitive to changes in blood flow. When blood pressure drops suddenly, vision is often one of the first senses affected. Some people experience a sudden feeling of fatigue, not tiredness from lack of sleep, but a wave of heaviness. It can feel like the body suddenly wants to sit down again. This is the nervous system's protective response. The body is signaling that it needs a moment to restore balance. Another sensation that surprises many seniors is a faster heartbeat. When blood pressure drops, the heart often responds by beating faster to compensate. This can feel unsettling. People sometimes think, "My heart is racing. Something must be wrong." In reality, this is often the body trying to correct itself. The heart is working to push blood upward, against gravity, toward the brain. This response is not always perfect after 60, but it is not automatically dangerous. Some seniors notice a sense of anxiety that seems to appear suddenly. This anxiety is not always psychological. It can be a physical response. When blood flow to the brain briefly decreases, the nervous system may interpret it as a threat. Stress hormones are released. Breathing may become shallow. This creates a feeling of unease, even if there is no clear reason to be afraid. This is why some people say, "I don't know why, but I suddenly felt anxious." It is important to understand that this anxiety does not mean something terrible is happening. It is part of the body's response to sudden changes in circulation. One of the most confusing aspects of sudden blood pressure drops after 60 is how quickly they can pass. Many episodes last only a few seconds. By the time someone considers checking blood pressure, the sensation may already be fading. This leads to doubt. Did that really happen? Was I imagining it? Should I worry? Because the episode is brief, some people dismiss it entirely. Others become hyper-alert, waiting for it to happen again. Neither reaction is ideal. Understanding what these sensations mean helps you respond appropriately. Another important detail is that these symptoms often happen at specific moments. Most commonly, when first sitting up in bed, when standing up from the bed, when standing after sitting for a while. They rarely happen while lying down. They often improve quickly when sitting again. This pattern is a clue. It suggests that gravity and position are playing a role. This is very different from symptoms that occur randomly or continuously. Sudden blood pressure drops in the morning also feel different from low blood sugar. Low blood sugar often comes with shakiness, sweating, hunger. Blood pressure drops are more about lightheadedness and posture. They also feel different from heart rhythm problems, which may cause irregular pounding or sustained palpitations. Understanding these differences can reduce unnecessary fear. Another thing many seniors notice is that symptoms vary from day to day. One morning may feel fine, another may feel unsteady. This variability can be frustrating, but it is common. Sleep quality, hydration, stress, and medication timing all influence morning circulation. This does not mean your health is unstable. It means your system is sensitive. Sensitivity increases with age. This does not make the body weak. It makes it more responsive. One of the biggest fears seniors have is fainting. True fainting from blood pressure drops does happen, but it is less common than many people think. Most people experience warning signs first. Lightheadedness, visual changes, weakness. These signs give you time to respond. Sitting down quickly, pausing, and allowing circulation to stabilize often prevents fainting. Knowing this can be reassuring. It is also important to say this clearly. Not every dizzy moment is dangerous, but every repeated pattern is worth understanding. That is why this video exists. By learning what sudden blood pressure drops feel like after 60, you are better prepared. Prepared to respond calmly. Prepared to move safely. Prepared to know when to seek advice. In the next part of this video, we will explain why blood pressure drops when you get out of bed. We will talk about gravity, the nervous system, and why this adjustment becomes slower with age. Understanding the cause will make these sensations feel less mysterious and much less frightening. To understand why blood pressure drops after getting out of bed after 60, we need to talk about what the body is doing during sleep and what suddenly changes in the morning. This is not a failure of the body. It is a transition. At night, when you are lying down, gravity is no longer pulling blood toward your legs. Blood is distributed more evenly throughout the body. The heart does not have to work as hard to push blood upward to the brain. During sleep, the nervous system is also in a resting mode. Heart rate is lower. Blood vessels are more relaxed. Blood pressure is often lower and steadier. This is normal, but when morning comes, the body has to switch modes. It must go from rest to upright activity. And that switch is not instant after 60. The moment you sit up or stand up, gravity suddenly pulls blood downward. Blood moves toward the legs and the lower body. This means less blood is immediately available to the brain. In a younger body, this change is corrected almost instantly. Special sensors in the blood vessels detect the drop in pressure. The nervous system responds quickly. Blood vessels tighten. Heart rate increases slightly. Blood flow to the brain is restored. Most people never notice this process. But after 60, this response can slow down. The sensors may not signal as quickly. The blood vessels may not tighten as effectively. The heart may take longer to adjust. This delay is often only a few seconds, but a few seconds are enough to cause dizziness or weakness. This process has a name, but you do not need to remember it. What matters is understanding the mechanism. It is not that blood pressure suddenly becomes dangerous. It is that circulation briefly falls behind during the change in position. Another important factor is the nervous system. After 60, the nervous system becomes more sensitive and sometimes less coordinated. The signals that control blood vessel tightening are not as strong as they once were. This does not mean the nervous system is broken. It means it is more delicate. Stress, poor sleep, dehydration, and illness can all make this coordination weaker. This is why some mornings feel fine, and others do not. Another major contributor is hydration. During the night, the body loses fluid through breathing and perspiration. You are not drinking water while asleep. By morning, blood volume can be slightly reduced. Lower blood volume makes it harder to maintain blood pressure. When standing, even mild dehydration can worsen morning blood pressure drops. This is especially true for seniors who do not drink much water before bed, or who take diuretics. Medication timing also plays a role. Some blood pressure medications are still active in the morning. Others reach peak effect around waking time. This can lower blood pressure further, just as you are standing up. This does not mean medication is wrong. It means timing matters. We will talk more about this in the next part. Sleep quality also influences morning blood pressure drops. If sleep is fragmented, the nervous system may already be stressed. Stress hormones can interfere with smooth blood pressure regulation. Ironically, this can lead to both high blood pressure and sudden drops. The system becomes unstable. This instability is common after 60 and does not always indicate disease. Another factor is muscle activity. When you walk or move your legs, muscles help push blood back toward the heart. This is called the muscle pump. When you stand up suddenly, without engaging the leg muscles, blood pools in the legs. The brain temporarily receives less blood. Standing slowly and engaging muscles gently helps circulation catch up. This is why sudden standing is more likely to cause symptoms than gradual movement. Temperature can also play a role. Warm environments cause blood vessels to relax. If your bedroom is warm, blood vessels may already be dilated. Standing up in this state makes it harder to maintain pressure. This is another reason symptoms vary by day. One morning may be cooler, another warmer. Small differences matter more after 60. Another misconception is that morning blood pressure drops mean the heart is weak. In most cases, this is not true. The heart may be healthy, but responding to a circulation challenge. This is an important distinction. Fear often leads people to assume the worst, but understanding the mechanics reduces unnecessary worry. It is also important to know that blood pressure drops after getting out of bed are often predictable. They tend to occur after long periods of lying down, when standing up quickly, when dehydrated, when sleep was poor. They are less likely to occur after gentle movement, after hydration, when rising slowly. This predictability means they can often be managed, and management is safer than reaction. Another important point is that repeated drops can train the body to respond better over time. When routines are adjusted, consistency helps. The body learns patterns. This is why gentle morning routines are so effective for seniors. They give the system time to adjust without overload. In the next part of this video, we will talk specifically about medications. Some medications can worsen morning blood pressure drops. Others may need timing adjustments. This is not about stopping treatment. It is about understanding interactions. That understanding can help you have better conversations with your doctor and avoid unnecessary fear. When sudden blood pressure drops happen in the morning after 60, many seniors immediately worry about one thing: their medication. They ask themselves questions like, is my blood pressure medicine too strong? Did I take something wrong? Should I skip my dose tomorrow? These reactions are understandable, but they are often premature. Medication can influence morning blood pressure drops, but it is rarely the only cause, and stopping or changing medication suddenly can be far more dangerous than the drop itself. So let's talk about this calmly and clearly. The goal of this part is not to create fear around medication. The goal is to help you understand how certain medications can contribute to morning blood pressure drops, so you can recognize patterns and have better conversations with your doctor. First, it's important to understand one key principle. Most medications do not act instantly. They work over hours. This means that what you took the night before can still be affecting your body in the morning. This timing matters more after 60, because the body processes medications more slowly. One group of medications that can contribute to morning blood pressure drops is blood pressure-lowering medications. These include medications that relax blood vessels, reduce fluid volume, or slow the heart rate. Again, these medications are often essential. They protect the heart and blood vessels over time, but in some people, their effect may be strongest in the early morning hours. If blood pressure is already lower during sleep, the medication effect can add to that reduction. Then, when you stand up, the drop becomes more noticeable. This does not mean the medication is wrong. It means the timing and dose may need review. Another group of medications to be aware of is diuretics, often called water pills. These medications help the body remove excess fluid. They are commonly prescribed for blood pressure, heart failure, and swelling. Diuretics can contribute to morning blood pressure drops. in two ways. First, they reduce blood volume. Less fluid means less pressure to work with when standing. Second, diuretics can increase nighttime urination. This leads to more fluid loss overnight. By morning, mild dehydration may be present. Even mild dehydration can worsen blood pressure drops when standing up. This does not mean diuretics should be stopped, but it does mean hydration and timing become very important. Another category to consider is medications that affect the nervous system. These include some medications for sleep, anxiety, pain, and mood. These medications can make the nervous system less responsive. In the morning, when the body needs quick signals to tighten blood vessels, those signals may be slower or weaker. This can delay the body's ability to maintain blood pressure when standing. Some seniors notice that dizziness is worse on mornings after taking certain nighttime medications. Again, this is about awareness, not blame. Medications that relax muscles or cause sedation can also affect balance and circulation. This combination can increase fall risk if blood pressure drops suddenly. Another group of medications to be aware of is medications for prostate or urinary symptoms. Some of these medications relax smooth muscle in blood vessels. This can be helpful for urinary flow, but may lower blood pressure, especially when standing. This effect is often strongest when first starting the medication or when doses are adjusted. Seniors may notice new dizziness after a medication change. This is an important clue to share with a doctor. Certain heart medications that slow the heart rate can also contribute. A slower heart rate means less ability to compensate quickly when blood pressure drops. This does not mean the medication is harmful. It means the body may need more time to adjust when changing positions. Another important factor is medication combinations. Each medication alone may be well tolerated, but together, their effects can add up. For example, a blood pressure medication, a diuretic, a sleep aid. Each may slightly lower pressure or responsiveness. Combined, they may make morning drops more noticeable. This is why reviewing the full medication list is so important. Many seniors see multiple providers. One doctor may not always see the full picture unless it is shared. Another key point is that medication effects can change over time. A dose that worked well for years may feel different as the body ages. Kidney function changes, metabolism slows, sensitivity increases. This does not mean medication has failed. It means adjustments may be needed. One of the biggest mistakes seniors make is changing medication on their own, based on one or two symptoms. Skipping doses can lead to rebound effects. Stopping suddenly can increase risk of heart attack or stroke. Any medication concerns should be discussed calmly with a healthcare provider. Bring information, not fear. Describe when symptoms occur, what time medication is taken, how long symptoms last, what helps them improve. This allows for safe adjustments if needed. Another important thing to understand is that medication-related blood pressure drops often improve with simple routine changes: standing more slowly, hydrating in the morning, sitting before standing. These steps may reduce symptoms without any medication changes at all. This is why understanding comes first. Medication is one piece of a larger system. When the system is supported, medication often works better, with fewer side effects. In the next part of this video, we will talk about what not to do when blood pressure drops in the morning. Some common reactions actually increase risk. Learning what to avoid is just as important as knowing what helps. When blood pressure drops suddenly in the morning after 60, the body is already in a sensitive state. What you do in the next few moments can make the situation better or noticeably worse. Most problems do not come from the drop itself. They come from how people react to it. Many seniors make the same mistakes, not because they are careless, but because no one has explained what actually helps and what quietly increases risk. Let's talk clearly about what not to do when blood pressure drops in the morning. The first and most common mistake is standing up quickly again. When dizziness or weakness appears, some people try to push through it. They think standing upright will help the body adjust faster. In reality, this often makes symptoms worse. If blood flow to the brain is already reduced, forcing the body to remain upright can delay recovery. The safer response is to sit down or pause. Giving the body a few seconds allows circulation to catch up. Trying to fight the sensation often increases the chance of fainting. The second mistake is panicking. Panic feels natural when the body suddenly feels unstable, but panic activates stress hormones. These hormones change breathing patterns, tighten some blood vessels, and increase heart rate. Instead of helping blood pressure recover, panic can prolong symptoms. This does not mean ignoring the sensation. It means responding calmly. Fear turns a brief circulation issue into a longer, more uncomfortable experience. The third mistake is checking blood pressure immediately, over and over. When symptoms occur, many people reach for the blood pressure monitor right away. They take a reading while standing, or while feeling anxious, or while breathing rapidly. These readings are often misleading. They reflect a moment of instability, not a true baseline. Seeing a low number during this moment can increase fear, which further disrupts blood pressure regulation. Repeated checking creates a cycle. Symptoms measurement fear worse symptoms. This does not provide useful information. It increases stress. The fourth mistake is holding the breath. Some people, without realizing it, hold their breath when they feel dizzy. Others take shallow, rapid breaths. Both responses reduce oxygen delivery and worsen lightheadedness. Breathing is one of the fastest ways to help circulation stabilize. Holding the breath deprives the body of that support. The fifth mistake is skipping meals or fluids afterward. After a morning blood pressure drop, some seniors avoid eating or drinking because they feel unsettled. This can worsen the problem. Low blood sugar and dehydration both reduce the body's ability to maintain blood pressure. Even small amounts of fluid can make a difference. Avoiding intake keeps the system vulnerable. The sixth mistake is changing medication on your own. This is a critical point. When symptoms appear, some people skip their blood pressure medication or delay it without guidance. Others reduce doses because they fear blood pressure is too low. Sudden medication changes can be dangerous. They can cause rebound effects that increase cardiovascular risk. Medication decisions should always be based on patterns, not isolated moments. If symptoms persist, they should be discussed with a healthcare provider. The seventh mistake is assuming every episode is an emergency. Not every blood pressure drop requires urgent care. Treating every episode, Wells crises, creates chronic anxiety. Chronic anxiety itself destabilizes blood pressure regulation. This does not mean ignoring warning signs. It means learning the difference between transient symptoms and dangerous patterns. Clarity reduces fear. Fear reduction protects the heart. The eighth mistake is lying flat immediately without support. Some people drop back into bed abruptly when dizziness occurs. While resting is often helpful, lying flat suddenly can sometimes make symptoms feel worse. A seated position with back support often allows smoother recovery. Slow, supported movements are safer than abrupt changes. The ninth mistake is avoiding movement for the rest of the day. After a frightening episode, some seniors become afraid to move at all. They sit or lie down longer than necessary. This can weaken circulation further and increase stiffness and fatigue. Gentle movement, once symptoms resolve, helps circulation normalize. Avoiding all movement does not protect the body. It can increase sensitivity. The 10th mistake is not observing patterns. Focusing only on a single episode misses valuable information. Morning blood pressure drops often follow patterns. They may occur after poor sleep, after dehydration, after certain medications, after standing too quickly. Noticing patterns helps guide safer routines. Ignoring patterns keeps the problem mysterious. Another common reaction is self-blame. Some seniors think, I must be doing something wrong. This is not helpful. After 60, the body's regulation systems are more sensitive. Sensitivity does not mean failure. It means the body needs more time and care. Judging yourself adds stress without solving anything. The final mistake is not talking about it. Many seniors keep these experiences private. They do not want to worry family. They do not want to bother their doctor. But clear communication helps prevent misunderstandings and unnecessary fear. Describing symptoms calmly allows others to support you. You do not need to dramatize. You do not need to minimize. Just describe what you feel. Understanding what not to do is as important as knowing what helps. Avoiding these common mistakes reduces risk and improves confidence. In the next part of this video, we will talk about the safest way to stand up after 60. This simple routine helps many seniors prevent morning blood pressure drops before they happen. After 60, standing up is no longer a simple movement. It is a transition. And like all transitions in the body after 60, it works best when it is slow, deliberate, and supported. Many seniors believe dizziness in the morning means something is wrong with their health. In reality, it often means the transition from lying down to standing happened too quickly. The good news is this. For most people, morning blood pressure drops can be reduced with a safer standing routine. This routine does not require strength. It does not require equipment. And it does not require medication changes. It requires timing. Let's walk through the safest way to stand up after 60, step by step. Step 1. Wake up without moving right away. When you first wake up, do not rush to sit up. Stay lying down for a moment. This gives your nervous system time to shift from sleep mode to alert mode. During sleep, blood pressure is lower, and blood vessels are more relaxed. Waking up is not just opening your eyes. It is a whole body transition. Take 30 to 60 seconds to let that transition begin. You do not need to think. You do not need to check the time. Just allow your body to recognize that it is awake. Step 2. Gentle breathing. Before sitting up, before you move, focus on your breathing. Breathe slowly through your nose. Exhale gently through your mouth. The exhale should be longer than the inhale. This breathing pattern tells your nervous system that there is no emergency. It reduces sudden stress signals that can worsen blood pressure drops. Even 3 or 4 slow breaths can make a difference. This step is often overlooked, but it is one of the most powerful. Step 3. Sit up slowly, not all at once. When you are ready, sit up gradually. Roll to your side if that feels easier. Use your arms to support yourself. Avoid swinging your legs off the bed suddenly. Once you are sitting, pause. Do not stand right away. Sit at the edge of the bed, with both feet on the floor. This position allows gravity to begin redistributing blood without overwhelming the system. Step 4. Pause and let circulation adjust. This pause is critical. Sit for 1 to 2 minutes. During this time, your blood vessels begin to tighten. Your heart rate adjusts. Blood flow to the brain stabilizes. Many seniors skip this pause and stand too quickly. That is when dizziness appears. If you feel lightheaded while sitting, do not rush. Continue slow breathing. Let the sensation pass. Most symptoms improve within seconds when given time. Step 5. Hydration before standing. If possible, take a few sips of water while seated. You do not need a full glass. Even small amounts of fluid can increase blood volume slightly and support blood pressure. This is especially helpful if you tend to wake up dehydrated or if you take diuretics. Avoid caffeine at this stage. Caffeine can stimulate the nervous system before it is ready. Step 6. Engage the legs before standing. Before you stand, gently move your legs. Flex your ankles. Press your feet into the floor. Tighten your thigh muscles lightly. These movements activate the muscle pump. The muscle pump helps push blood back toward the heart and brain. This step is small, but it has a big effect. Standing without engaging the legs makes blood pool in the lower body. Step 7. Stand up slowly with support. When you stand, use support if needed. Hold the bed, a chair, or a stable surface. Stand up smoothly, not in one fast motion. Once standing, pause again. Do not walk immediately. Allow your body to finish adjusting to the upright position. If you feel unsteady, sit back down calmly. There is no rush. Step 8. Begin gentle movement. After standing comfortably, start moving gently. Short, slow steps are best at first. Movement helps circulation stabilize further. Avoid bending, lifting, or sudden head movements. During the first few minutes, let your body ease into activity. Step 9. Observe, not judge. Pay attention to how you feel, but do not overanalyze. Notice. Does dizziness resolve quickly? Does strength return? Does breathing feel normal? These observations help you understand patterns. They are more useful than chasing numbers. Step 10. Make this a daily habit. Consistency is key. The body learns routines. When you stand up safely every morning, the nervous system adapts. Over time, many seniors notice fewer symptoms and more confidence. This routine works because it respects the body's timing. It does not fight age-related changes. It works with them. It is important to say this clearly. Standing slowly is not weakness. It is wisdom. After 60, the body rewards patience. This routine will not eliminate every episode of dizziness, but it significantly reduces frequency and severity. For many people, and most importantly, it reduces fear. Fear makes symptoms worse. Confidence makes mornings easier. In the final section of this video, we will talk about when low blood pressure is dangerous and when it is a normal adjustment. This distinction matters because knowing when to stay calm is just as important as knowing when to seek help. By now, you understand something very important. Low blood pressure in the morning after 60 is not always a problem, but it is also not something to ignore blindly. The key is knowing the difference between normal adjustment and a situation that needs medical attention. This distinction can remove a great deal of fear, because fear often comes from uncertainty, not from the condition itself. Let's start with what is usually normal. A brief drop in blood pressure, when moving from lying down to sitting or standing, is common after 60. If the symptoms last only a few seconds, improve when you sit or pause, do not include severe pain or confusion. This is often a normal circulatory adjustment. The body is responding to gravity. Blood flow is catching up. The nervous system is recalibrating. These episodes are uncomfortable, but they are usually not dangerous. They become less frequent. When routines are adjusted, and when mornings are approached calmly, many seniors live with this pattern safely. For years, normal morning blood pressure drops often share certain features. They tend to occur at specific times, usually right after standing, improve with hydration and rest, vary from day to day, respond to slower movement. They do not usually come with persistent chest pain, severe shortness of breath, or lasting neurological symptoms. Understanding this can be reassuring. Now, let's talk about when low blood pressure may be dangerous. Low blood pressure becomes concerning when it is accompanied by serious symptoms, or when it represents a change from your usual pattern. Seek medical attention promptly. If low blood pressure is associated with fainting or loss of consciousness, chest pain or pressure, severe shortness of breath, confusion or difficulty speaking, new weakness on one side of the body, severe or persistent dizziness that does not improve, and these symptoms suggest that vital organs may not be receiving enough blood. In these situations, waiting is not the safest choice. Another concerning situation is frequent or worsening episodes. If blood pressure drops are happening more often, lasting longer, or becoming more severe over time, this deserves evaluation, especially if these changes are new. The body does change with age, but sudden shifts in pattern should not be ignored. Another red flag is injury related to dizziness. If low blood pressure leads to falls, near falls, or repeated loss of balance, this increases risk significantly. Preventing injury becomes a priority. Medication side effects, dehydration, or underlying conditions may need adjustment. Low blood pressure can also be dangerous if it occurs alongside illness, infections, dehydration from vomiting or diarrhea, or fever can lower blood pressure further. In these cases, even a mild drop can become significant. Context always matters. One of the most important messages to take from this video is that numbers alone do not define danger. A single low reading, without symptoms, is rarely an emergency, but moderate drops, with concerning symptoms, may require attention. This is why listening to the body is so important after 60. The body often signals trouble before numbers do. Another key point is communication. If you are unsure whether symptoms are normal or concerning, talk to a healthcare provider. Bring details, not fear. Describe when symptoms occur, how long they last, what improves them, how often they happen. This information helps guide safe decisions. Avoid minimizing symptoms out of fear of bothering someone. Your health matters. At the same time, avoid catastrophizing every episode. Living in constant alarm creates stress. Stress destabilizes blood pressure regulation. Balance is essential. This balance, between vigilance and calm, is what protects health after 60. If there is one central message to remember from this entire video, it is this: low blood pressure in the morning, after 60 is often a sign of sensitivity, not weakness. Sensitivity requires thoughtful routines, not fear-based reactions. When you slow down, hydrate, breathe calmly, and stand safely, the body often responds well. When you understand warning signs, you know when to act and when to stay calm. This knowledge is empowering. It allows you to move through your mornings with more confidence and less anxiety, and confidence itself improves circulation. Before we end, let's connect this video to the larger picture. Morning blood pressure, high or low, is influenced by sleep, hydration, medication timing, and daily routines. That is why this channel focuses on patterns, not isolated numbers. If you found this video helpful, there are other videos on this channel that build on what you learned today. We talk about safe morning routines after 60 Seth. When morning blood pressure is an emergency, why blood pressure spikes between 3 and 5 a.m. Night habits that support healthy blood pressure. Watching these videos together creates a clearer understanding of how the body changes with age. If you want calm, clear guidance about blood pressure and senior health, this is exactly why you should subscribe. Not because something is wrong, but because understanding prevents problems. One video cannot answer everything, but a series can. Subscribing allows you to continue learning at your own pace, without fear, without pressure. In the next video, we will explain why blood pressure can spike early in the morning and what to do about it safely. That video connects directly to what you learned today. For now, remember this. After 60, the safest mornings are not rushed. They are supported. And when the body is supported, it often does exactly what it is meant to do. Thank you for taking the time to care about your health.